Hi everyone, Dr. David Perlmutter here, and we're going to spend some time together. We have a lot of news today, a lot of important developments to cover. Actually, some good news. I'll share that with you in just a moment. I will be delighted to take as many questions as I can. I want to let you know, and I will announce this later on when more people jump on, that I will be live tomorrow on national television speaking about coronavirus and answering questions. That'll be 9 a.m. on Christian Broadcast Network. I'll be interviewed there, and we will take some questions later on in the day. I'll be answering some more questions on CBN, and of course, 5 o'clock tomorrow afternoon, we'll all get together again. So I'm going to wait till some of you jump on. The first post that I'm going to place is hopefully going to answer a lot of questions that we are being asked with respect to what are the effective ways of sterilizing surfaces, doorknobs, etc. I think everybody knows about Clorox and Lysol and alcohol and all that, but it turns out that there are a lot of things that you may even have access to that are effective in terms of sterilizing the surface. And I'm going to give you this information in the link that I'm going to send you now. So what we've sent you is a link, this first link, that talks about actually, that is not the link I wanted to send you. That is a link of something we're going to talk about in just a moment. I will send you the link in just a moment with respect to the cleaners. This first link is very, very important. Research in England has just announced that they are giving a real push to an interferon beta drug, which is a sprayed, I believe, intranasally. They're getting it fast-tracked. This is a drug that is really very important because it is known that low interferon levels are associated with poor antiviral ability. And believe it or not, as crazy as it sounds, this coronavirus is able to knock down our own interferon beta level. So the link I sent you, this was announced today. The Respiratory Drug Discovery and this company announced they've received expedited approval from Medicines and Healthcare Products Regulation in England to get this product out. I have even better news for you, but this is something I think that we may get access to. It's a way of enhancing our immunity as it relates to this virus. But I think what is really very, very exciting is what is called Faviprevir. Faviprevir. F-A-V-I-P-I-R-A-V-I-R. An antiviral medication that has been developed by Japanese researchers and currently being used in China in the coronavirus treatment. Let me give you a link. This is very, very exciting. And let me tell you about this. This is announced several hours ago, as in today. Patients who were given the medicine in Shenzhen turned negative for the virus after a median of 4 days after becoming positive, compared with a median of 11 days for those who were not treated with the drug. This is a game changer. In other words, people now are not testing positive after they get the drug only after 4 days as opposed to 11 days. That will dramatically limit the spread. In addition, here's the other good news, X-rays confirmed improvements in lung condition in about 91% of the patients who were treated with Faviprevir, compared with 62% of those who did not receive the drug. So this is extremely exciting information, because this is something that I believe could be ramped up very, very quickly and made available, one would hope. Maybe if they could just work on working on the patent kind of thing and just take a pass on it this time and letting people manufacture it. So this is a drug that's actually manufactured by a company that is controlled by Fuji, the makers of Fujifilm, and something must be going on because there's a lot of interest in it. So this is really, really exciting. I'm very happy to share this news with you. For anyone who's interested to know what's going on in the background, we know what's going on in the foreground because the news is telling us that. The news is really painting a grim picture. I can't say necessarily that is an inaccurate picture from what we are seeing, at least in terms of the numbers. And we're going to look at some more numbers here in just a moment. We're going to look at what's going on state by state in terms of, and I'll give you a link, in terms of what the tests now for coronavirus are showing. But here's a question I'm sure that many of you are asking, and I want to answer it preemptively. And it is a study that came out, just came out, and it's a Chinese study. They're doing some great research. They're our friends and are helping, and we need to treat them as such. And here's what they determined. And I'll read to you the quote, and then we will walk through what it means. The proportion of pre-symptomatic transmission was 48% in Singapore and 62% in Tianjin, China. What is pre-symptomatic transmission, averaging, let's say, about 55% between these two studies? This is extremely important. It means that about half the time people are getting the virus from another person who does not have symptoms. Meaning, the idea of treating or checking people by screening them for their temperature, hitting them in the forehead with a thermometer, saying, oh yeah, you're cool, come on, pass through, or getting off a plane, that half of the transmission seems to be coming from people who have no symptoms whatsoever. And Sanjay Gupta said today that we should consider that everyone is a carrier. Now that's certainly overstated, but we don't know. We don't know who is or who isn't unless they are tested, and also, if that's not available, unless we can quarantine that person for, let's say, 14 days. 14 days is not 100%, it's about 96% and change. So this is a very important answer to a question that I know a lot of you are wondering about, and that is, well, so-and-so wants to come to my house, they're fine right now, should I let them come and stay with me and my young children or my infant son or whatever it may be? Understand that half the transmission is happening between people who are asymptomatic. It means the possibility of people who are handling your food in the grocery store, who are interacting with you. It's why this social distancing, the video I gave you yesterday, is so incredibly important. It's why, unfortunately, for restaurant owners, I'm going to say restaurants need to be closed now. Bars need to be closed. I understand it's an economic impact, but those are powerful vectors for transmission of this virus that we all see is increasing dramatically, and we're going to look at some numbers, in fact, right now, and then we'll take some questions. I'm going to open a link here, and here's the link that I'm going to open, and it's the link that you'll see in the feed called Coronavirus by State. We're certainly not going to go we're certainly not going to go by state. I'm just seeing some of these questions. I'll get to as many as I can. Control V. Okay, here you go. So let me get to this very interesting data, because I think it's a very important story that it's telling. And here is what we're learning. Let me just go to that. Stand by. Okay, here it is. So this is from Politico, and I just sent you all the link to this. And it asks the question, how many coronavirus cases have been reported in each state? Well, if you go to the link, you can see what's been reported in your state. That's interesting, but I think what is far more important, far more interesting, is if you go to that link and you scroll down, there's a wonderful comparison, and thank you, Austin, for sending this to me, between the number of tests that have been performed in a state and the number of those tests that are positive. For example, in New York, where they've tested 7,000 people, about 1,700 of those have been positive. In Washington State, 904 out of 12,000 are positive, which is a low rate. However, in New Jersey, there are 260 positive tests in only 485 tests given. Certainly, we might be able to extrapolate once we, in terms of how many tests might be positive, based on when we finally get a lot more tests. So I'd like you to look at that and look at a state like Georgia, where they've done only 146 tests so far, and of those 146, 146 are positive. That means everybody in Georgia who has been tested for the coronavirus has tested positive. My point is that there is a range between some states where there's a lot of testing and not much positivity, and other states like Georgia where everyone who's tested was positive. There's another, I think it was Hawaii, that showed, Hawaii, 10 tests given and 10 proving positive. Missouri, 215 tests given and only 8 are positive. What's that? That's about 4%. So it's just, I think, important for you to look at that. And I'm going to tell you a little story now about what I did today. I got on my bike, I rode down the street, and I come up to the hospital just to see, hey, what's going on? I'm on my bike, I'm safe. And I see a sign at the hospital that says coronavirus testing. And I didn't see anybody there. I kept riding, went around the parking lot. In the back of the hospital is where the line was forming for people in their cars for coronavirus testing. And I was riding along the cars, and one woman had her window down, and I talked to her from a very safe distance, and I said, how long have you been waiting in line? It was about 10 o'clock in the morning. She said, I've been here since 5:30 this morning. And I asked her, I said, everybody can get a test, you just get in line? And she said, no, you have to have a doctor's prescription. You have to be pretty sick in order to get the test. What does that mean, you have to be pretty sick? Well, that means you might have a coronavirus, right? If you're pretty sick. Of course, you could have anything else. You could have the flu, you could have a cold. Then I proceeded to ride my bike down the line, and I look at the cars, and they keep going, and they keep going, and I look down the street, around the corner, and they keep going. And I would estimate there were several hundred cars, and if half these people are positive, it means that while we are only reporting 10 active cases in the county in which I live right now, if half the people lined up in that line today getting tested were positive, it means that our numbers are going to go up quite dramatically. The only other issue that I will report is I asked the woman, how long will it take to get your results back? She said 3 to 5 days. They have to send them off. So it means we're not going to really get the impact in terms of implementing changes in terms of what local and state governments are telling us for at least 3 to 5 days in terms of the testing that's going on now. And that's unfortunate, because action should be taken right now, in my opinion. I'm going to take some questions now. And I want to just mention just another couple of things before I jump to these questions. And there are so many of you. I guess there's, 1,000 of you on watching. Thank you, and I hope this information is helpful. Join me tomorrow on Christian Broadcast Network, 9 a.m. live nationwide. I'll be answering questions at that time. I think you got to remember, this is very important. Everybody in the question is asking questions about what can we do to augment our immune systems. Well, I would indicate that great questioning, but what we should also be asking is, what is it that's downregulating or damaging our immune function? And one of the key players is stress. Big thing. Stress makes us less competent as it relates to our immune function. It's why we all get colds when we're under stress, etc. So what I'm saying is, get away from the TV. Sure, get up to date, learn some things, go to a couple of reputable websites. I gave you a few that I used yesterday, but don't, Yiddish word, kvel, in front of the TV all day long, because that's going to raise your stress level, and it's going to make your decision making worse, not better. Your decision making will be more impulsive and not as thoughtful. Get some fiction. Read some fiction. Here's what I finished a couple days ago. Here's a great book. I'm just going to recommend Where the Crawdads Sing. Terrific book. Has nothing to do with what's going on, and it's good for you to get out of what's going on for a little bit and divert your attention away to something less stressful. So I think that's very important. I think do your very best to get as much sleep as you can. All the things that we've talked about on drperlmutter.com, certainly here on Facebook, about your sleep hygiene, about limiting your exposure to blue light at night, getting away from the computer, not watching TV at night. Go to bed a little earlier. I find that I am waking up really early now, not able to fall back asleep. But if you go to sleep early, then it's okay to wake up early. You'll still get 7 or 8 hours of sleep. Don't give up on your exercise, though you may be stressed. Exercise is good for your immune system, and get outside. Walk around your neighborhood. Keep a distance from people. I see people are doing that. And get outside as best you can. It's really very important to offload this stress. You know, that may be as important as all the supplements people are talking about that may be good for augmenting immune function as well. I promise after today, at the end of our time together today, I have a great poem that I will read. I guess that's sort of a thing that we are doing now. Let's turn to our questions. Here we go. Okay, here we go. Don't see a link, not sure. I've posted all the links. Maybe I didn't post the link to the one I've just talked about. You know what? I'll just do this again to the thing that talks about, the link that talks about the states and their positivity. Okay. How do I represent the percentage compared to those in Italy? I see that we are on track, confirmed positive test to be about 10 to 14 days. Yeah, we are behind Italy. And what you see going on in Italy likely is what you're going to see happen here. And somebody was telling me earlier that, well, you know, it's great because his food is still abundant in Italy. Everything, you know, seems to be great. Well, good, but it's not over yet in Italy either. So it's going to get worse in Italy till it gets better. I think that having some supply of food at home is a good idea. I think hoarding food may not be great for everybody. I mean, if you hoard food, there may be less food for other people, so consider that. I can't give you a time that you might need food for, but by all means, make sure it's non-perishable. Things like canned foods, frozen foods, and pasta. Did I just say that? Yeah, I did. Choose gluten-free if you can, but obviously that's just a luxury at times that we may not have access to right now. But rice is cheap and available in still many of the stores. You can buy a huge bag of rice, and you know, it may not be organic, but you know, right now we're going to have to suck it up a little bit and have food available to us. Data for total tests given in Georgia and Texas, I hope I can read it, is only available for positive cases. I'm not sure. These questions are going by so very quickly I can't even read them. I can't scroll back for some reason. I think that what the inference was that, yes, that the policy decisions are being made based on the positivity, the number of cases that are diagnosed in a particular area. We need to think more than just about today. We need to think about where we'll be tomorrow and a week from now. That is the plea that you hear from people in Italy. United States of America, please take this seriously. If we only had known, we would have practiced the social distancing a heck of a lot sooner. That's what they're telling us. We've got to listen. Hello from Grand Ledge, Michigan. Great. I was so sick in January, negative test results, strep throat, had all the same symptoms, coronavirus. I was weak. Yeah, people can get sick with other things, that's for sure. That's why there's testing. But if there's a way that you think you could just stay at home and isolate yourself and you feel like you're stable, that's the thing to do. Ending up in a hospital, if you're really sick, is of course something you have to do. And I want to reiterate something I said yesterday, and that is that, you know, when people define mild cases as being something that doesn't require that you go to a hospital, what we're understanding is some people with so-called mild disease are actually very, very, very sick. Great. Just finished the book I'm reading, the fiction. Moringa tea. We have moringa tea, actually. We have a moringa tree. Eucalyptus inhalation, can't say. There is some data, and we talked about that several episodes ago, about moringa, and we bought some moringa as a supplement. There's some data on that being effective in general for inflammation and specifically with respect to the lungs. I'm certainly not saying that Moringa is effective against coronavirus. I will say that in terms of nutritional supplementation, I'm taking 50 to 100 milligrams daily of zinc. I'm also taking, for me, 10,000 IU of vitamin D3. Do I have data that this is an effective protocol with respect to coronavirus? I do not. Do I have data indicating that this does, at least with respect to the vitamin D, increase antiviral activity? I do have that data, and I have posted that in earlier videos. If you want me to post it again, I'm certainly delighted to do that. Time check. Okay. So yes, thank you with respect to nature. And how long do I predict the pandemic to last? I don't know. It's a very tough question because we don't yet understand the dynamics of this virus. In other words, two important things. Can you become reinfected with the same virus? Can the genetics of this virus slightly change and then reduce our ability to be immunoprotected with respect to reinfection? We don't know that. It has been discussed by experts that this may become a seasonal event, much as influenza has. Yes, where the crawdads sing. I happen to enjoy the book. I think it was great. The prefrontal cortex versus the amygdala. We can live outside of fear. And let me explain what Cassandra Inman is talking about. We talked about that in Brainwash. That's the book on the top of this page. That we can do things to allow us to access better decision making that comes from the front part of the brain, the prefrontal cortex, as opposed to more impulsive, fearful decision making, which is that coming from the amygdala. That's what we talk about in Brainwash, and I may mention that tomorrow. I'm not sure. I think we're going to do some real pragmatic sorts of recommendations. I'll take a few more questions, and Germany is only reporting 28 deaths with 12,000 cases, lower than Korea. Do you think that is accurate? Hard to say, but may well be. There are places like South Korea around the world where they are being very, very aggressive, and in terms of containment of proven cases, but also may be able to treat in ways in terms of support that may be working. Don't know the answer to that. I think that the explanation that's been given is that countries that generally have a younger and more fit population seem to be doing better. We do know that various Asian countries have access to things like gloves and masks more readily than apparently we have here. Stress and sleep management, I think you forgot to mention above all diet. Well, Justine Struess, we've been talking about that quite a bit throughout these broadcasts, but thanks for bringing it up. And I would say that that's a very important point. A low inflammation diet is important. So the sugars and refined carbohydrates, if you can avoid them, now is the time. Good fats, good omega-3s, if you have access to them. Limit your consumption of pro-inflammatory, shelf-stable fats that may be increasing inflammation. And okay, let's keep going. What is the drug that I referred to earlier? I would say, folks, if there are things that I referred to earlier, by all means you can scroll through. But let me I think I want to revisit that. It's called Faviprevir, Favipiravir. Again, this is a drug that is proving to be very effective. There's a study that has been undergone in China. They are treating several hundred people and showing that the speed at which people become virus negative average has gone down to 4 days as opposed to those who were not treated, which is 11 days. That's huge in terms of potentially reducing spread and certainly helping those people who are sick. And also looking at how many more people, 91% showed significant improvements in their lung conditions. I'm not sure if that's functional with lung studies versus x-ray improvements. who were treated with Faviprevir compared to 62% of those who did not receive the drug. And apparently, here's a quote about it from one researcher. It has a high degree of safety and is clearly effective in treatment, and that is certainly something we want to keep our eye on. Again, I'm going to send you the link now, and I'd like you all to take a look at that. Okay, there you go. Low-dose naltrexone, interesting. I'm not thinking that's got much play here, but we'll see if there's any research to support that. Okay, let's keep going. My dosage personally of vitamin D right now is 10,000 IU of D3. You should check with your healthcare provider. CBD helps with stress and insomnia. Yes, I certainly wouldn't promote CBD as an anti-coronavirus treatment, but if it was stress, that's probably a good thing to have on board. We know that it also is somewhat effective in reducing inflammation. Maggie Flanagan, my links will show up. There's so many posts that have come up that they're going to be delayed, but they do show up anyway. Okay, I have a few minutes left. I see there's a lot of communication between each other, between you guys. That is great. If anybody has an idea as to another forum that we might use that might be more interactive, we'll talk about that. I'm going to try to do some Zoom interviews with experts on Facebook. I know we have the technology for that. I just need to walk through it. Again, Fernanda Basillo, it is 10,000 per day of D3 that I am taking. I don't know what your medical conditions may be or your baseline vitamin D level. There you go. So let me look at a couple more questions. And I think people are just basically asking for repetition of things. And I will repeat a couple of things. Dark chocolate. Oh, there you go, Tiffany. I'm all there with you. Will we get to a point where grocery stores close? I don't know the answer to that. Of course, who would know? It may be that the grocery store shelves will be empty and they will be waiting on their resupply trucks. I think that will continue. My hope is that will continue for some time. We know that the government also has food in storage that we are told can be tapped into if need be. So what I'm saying is that it's all about common sense right now. I just took a deep breath. I think that's good advice. That, as I said earlier, a failure to prepare is preparing to fail. So we really need to make preparations now and keep in mind the things that we've talked about, and that is social distancing, that is limiting contact with people. Ask yourself, is it really that critical for me to go out? Do I really need a haircut right now? All of these things, it's a new reality for all of us. We can protect ourselves. It's been estimated that 70% or more of all of us are at risk and will likely get this coronavirus. The idea that of those 70%, perhaps 20% might need more aggressive care is a number that is certainly compelling in terms of our hospital ability to care for those people. And that's what this discussion about so-called flattening the curve is all about. And I'd like each and every one of you to think about what we can do to flatten the curve. Means, yeah, if we get it, and that's likely, more likely than not, that we're going to get it. If we could get it in 3 weeks or in 4 weeks as opposed to next week, that would be a good thing, because next week and the week after, there'll be a surge of people who need to perhaps be hospitalized. So that's what each and every one of us can do to help, as they say, flatten the curve. That's certainly part of our vernacular at this stage. So this Faviprevir, I've sent 2 links out on it, Barbara, so scroll through. And Anna Quebeca, you are wonderful, and I've always loved you, and thank you for all that you do. You're fantastic. Okay, folks, thank you from Hawaii. And everybody, thank you for spending time with me today. I see there's yet another question about elderberry, and We talked about the research with respect to elderberry, that yes, it has been shown to be effective in reducing the time course of rhinovirus. Will it be effective here? Who knows? What I did find out in researching elderberry a couple of days ago is that the amount of the elderberry active ingredients or effectiveness things, the parts of elderberry that seem to be working, are highly variable, from almost none to actually a many-fold increase compared to what was described on the package. I can tell you that I don't believe there'd be a harm in elderberry. So maybe we'll take that. Just take that in stride. What about takeout to support local businesses as it relates to restaurants? Well, let me tell you, keep in mind that the plastic wrap may be contaminated by somebody who just handled that, coughed, rubbed, touched the bag. So keep that in mind. If you have to take the bag, spray it on the outside. If you have a spray that you carry with you when you get home, you're going to want to maybe nuke, dare I say, microwave the food if it's on a paper plate, not a metal plate, that's for sure. So not because I can tell you microwaves are going to inactivate the virus, but because heat does. So keep that in mind. I mean, you have to get food from somewhere. All right. I'm going to be back tomorrow. And thank you, everybody, for listening in. There are some good websites that people I'm in touch with who are posting some very good information. They're gonna share these Facebook posts on their sites as well. Again, join me tomorrow morning, 9 a.m., Christian Broadcast Network. And I'm going to leave you with the book. People are asking about that again. It's just a great book. There's so many out there. But what I'm saying is read some fiction. That's not too stressful. It will help you. This is a poem by L.H. Theaker, Theaker. The grass is green across the hill, but yellow blooms the daffodil. It's sunshine on a little stalk, a friendly flower, I bet they talk. Of little kids, too long inside, they burst outdoors to play and hide, tracking mud and bringing bugs. Look, there's footprints on the rug. Tiny whirlwinds, these little tykes. They skin their knees while riding bikes. They rip and roar. They're running wild. What fun it is to be a child. It grows warmer every day. Shoo the children out to play. Pick the flowers, play in mud. Too much rain. Here comes a flood. My snowy winter days are gone. I mourn them, but I hear a song of birds in trees. Wind chimes ring. Lots of love in my heart for each and every one of you. I will check back tomorrow. Bye for now.